Hi everyone, my name is Rebel Siddiqui and I will be presenting on behalf of my team findings from our study comparing the outcomes of patients that undergo total hip arthroplasty using a direct anterior approach or a Hardinge approach. I have no conflicts to disclose. The direct anterior approach is increasingly popular in total hip arthroplasty. Current evidence also supports that the direct anterior approach allows for faster post-op mobilization and decreased length of stay. However, due to the learning curve involved for the orthopedic surgeon, there may be an increased occurrence of adverse events. We compared the outcomes of patients that underwent total hip arthroplasty using the direct anterior approach and the Hardinge approach. Data were collected retrospectively from electronic medical records of patients that underwent total hip arthroplasty using one of the two surgical approaches by a single orthopedic surgeon from January 1st, 2018 to December 31st, 2021. Patients were divided into two cohorts depending on the surgical approach taken for their treatment, and patient characteristics such as age and sex, surgical details such as size and duration, and outcomes such as emergency department visits and post-operative adverse events measured by the OrthoSafe severity grading system were collected. A generalized linear model was used to compute an adverse event risk ratio by surgical approach. Within the model, we adjusted for patient characteristics, age and sex, and surgical side. To compare adverse event severity grade, unadjusted relative risk of an adverse event requiring treatment by surgical approach were calculated. In total, 301 patient charts were included in the analysis, of which 187 were in the direct anterior cohort and 114 in the Hardinge cohort. Patient characteristics, surgical details, and return emergency department visits were relatively similar across the two cohorts. Compared to the Hardinge cohort, the direct anterior cohort had a higher number of male patients, but otherwise similar mean age and similar rate of emergency department visits were seen. Of note, patients in the direct anterior cohort had lower adjusted risk of an adverse event compared to the Hardinge cohort. However, a great proportion of direct anterior cohort cases had a higher grade of adverse event that required treatment compared to the Hardinge cohort, but the relative risk was not statistically significant. Therefore, the findings suggest that the outcomes are similar between the two approaches, and both approaches may be viable options for patients undergoing total hip arthroplasty. Thank you for your attention and interest in our study, and I look forward to any questions you may have.